I got to know John back in his first days of training. We went through training together through both residency and knew each other after fellowship, and then through being on the faculty together. So truly, as a Lifetime Achievement Award, I can say that I've been through a pretty good chunk of your lifetime here at Glennon, John, and it's been wonderful.
He was one of the first people I met when I came to Cardinal Glennon, and he was extremely welcoming, even though we were both applying for the same job. And after I accepted the position here and arrived, I knew the talent that I was experiencing and being around John, and I asked him to be our Associate Medical Director, which he graciously accepted immediately after I came here. I'm not sure I would have been able to do the job successfully without John for the first several years being the Associate Medical Director.
JP is really defined by, I think, his calm demeanor, certainly his compassionate care for the children that he sees in the emergency department. But I think what a lot of people don't realize is what he does on the medical education side. He's got a way of teaching and bringing you to the answer, both in the emergency department or on a challenging case for our residents and faculty on the inpatient service. He really can connect and just make sure that you get there. He's also such a valuable person for Cardinal Glennon and how he's really ushered in from the medical administration standpoint so many challenging conversations and difficult negotiations back and forth over the years that he really is, and has long-standing been kind of that voice of reason where he can truly see and discern both sides in a matter, and I've always respected him for that.
As a transport nurse, he reviewed all of our trips and would critique them and give us feedback. And at first it was really scary, but we quickly learned that his feedback really was a gift. And it would be funny, he'd say, well, you could have done it this way. But he always delivered it in a nice way that helped you learn from the trip and how you could do a better job. He'd always tell you what you did really well and really helped you improve through his feedback.
They really need support to go through what happened on the transport, and he's always been very good about helping people get better, but more importantly, helping them remember how good they are and what kinds of things that they've done right.
When he was asked to be president of the medical staff, I thought that was a perfect choice. And then when his time as president of the medical staff was finished, I was approached by the hospital administration about the thought of him becoming the next chief medical officer, and I said unequivocally, you can't do better than John Peter as a chief medical officer. And then he came to his senses and decided to be a clinician again, and just decided to come back where he belongs, in the emergency department. So we all come to that conclusion sooner or later in our career, but JP figured it out. I think with the help of Mary, because she's the one who really dictates what goes on in that family.
You're the consummate pediatrician and caregiver. You really exude a kindness and thoughtfulness for people that I think has always made your practice of medicine and patient care wonderful. Interesting, though, how you wove that into an administrative career as well, and took that same level of care for individuals to outside their health-related problems and or issues, but to how the place works and how we work together as a group and really maintain the morale and the mission. That's really what makes Glennon special.
I love it when JP's covering the emergency room, because I know we have an ally that's working with us, and I know that we'll have a good working partner, particularly when you're worried about trauma patients that come in and complexity and serious injuries, and to know that you have a good solid partner leading the emergency department and the emergency room team as we work together, surgeons and ER physicians. It's always very reassuring to know that he's there.
In my role this past year as our chief medical officer, following John has been really big shoes to fill, and I discovered that several weeks and months leading up to my stepping into that role, just hearing about more of what he had done, and then certainly in the first few months and over the past year of the impact that he's had on a lot of committee work and advocacy and behind-the-scenes functionality for the hospital. And it's amazing to me for him also balancing his clinical time in the emergency department, teaching working with faculty, not only in the Department of Pediatrics, but really across the way.
It's someone you should emulate. He is Cardinal Glennon. He has spent his whole career here. He defines his career on how well he takes care of patients and how people remember his interactions with them. And for that reason, he is Cardinal Glennon.
He just always had kind of an open door policy. I would call him to ask him a question. He'd say, come on up, sit down in my office and talk through this problem with me, which was extremely helpful just to have someone that could kind of problem solve with me.
I know that smile and that voice as far as, talking on the phone, and even now over the last year, just saying, John, this is a hard question. I need your help. Let me bounce this off of you. What would you do in this situation? And I really respect and appreciate that, and the ability, not only as a friend and colleague, but still as a mentor for me, just to be able to kind of talk to and kind of bounce things off each and every day. And he's always available, and no questions asked, he'll take it.
Classic John Peter is the smile on his face after he decided not to be an administrator anymore. That's classic John Peter. He looked like a weight was off his shoulders. He is getting back to what made him become a doctor in the first place, which is his love for children and his love for clinical medicine, and now he gets to do that full time. And that's classic John Peter. We're all good at other things as physicians, but we choose medicine because we really love it. And it's classic John Peter is the fact that he smiles much more coming to work each day now that he's a clinician again.
What door, hallway, file cabinet, person, patient room in this hospital do you not know or have a story about? You've been in every element of this hospital, from teaching to patient care, through I don't know how many different emergency rooms, neonatal intensive care units, pediatric intensive care units, and have embodied really the transition of Glennon to the premier children's hospital that it is today.
Truly, JP, I can think of nobody else who would be more deserving to be nominated for an award like this. Lifetime achievement really kind of at Cardinal Glennon defines what you've given, not only service-wise, out in front of the camera, but I know that you'd much rather be behind the scenes, and that's truly where you've excelled and led the rest of us to show how to get there. So congrats to you. Thanks for everything. Back from 2003 to now and really beyond. I'll always look at you as a mentor and someone for great advice, and thanks to all you do for Cardinal Glennon.
Congratulations, John. Great job. You really deserve this award.
Congratulations, JP. You are so deserving of this award, and it's been so great working with you.
Congrats, JP. Don't think about retiring.
JP, congratulations. I was super excited when I heard that you were getting this award. It's an honor to be part of this video, and truly appreciate all that you've done for me and for us here at Cardinal Glennon.
John, I know you've never been in this for awards and have never looked for an award, but you're just gonna have to take this one. You've spent a life bringing humility, thoughtfulness, kindness to innumerable children and their families. You've done that as well with fellow faculty and staff, and really helped develop the morale that builds this hospital and that this hospital is based on. So you've had a lifetime achievement. It's been subtle because that's the way you would do it, and very effective because that's also the way you would do it. And it was done through kindness and humility.